My name is Maeata'anoa and this is my EJV OSCE. Essentially, why you would want to IV cannulate the EJV is because there are no other sites that you can successfully IV cannulate, and if it's indicated for an IV, so a potential need for IV fluids or IV drugs, which this patient does have, I would make sure I have my PPE on, my gloves, my glasses. I would gain consent from the patient, so I'd say, "Sir, ma'am, is it okay if I place a IV on your neck? You're going to feel a sharp scratch and it will just enable us to give you IV fluid and drugs, which can help you." Yes, okay, so I've got consent. I would have drug checked my posi flush, my sodium chloride in my 5 ml syringe with my crew partner or offsider, checking that it's within expiry, that it's the right dosage and the right drug. And it's unopened, which I've already done. In terms of positioning the patient, you want to be able to actually see the jugular vein, so it's good if they're distended. So the ways you can do that is you can place the patient in a supine position, ask them to elevate their legs, ask the patient to bear down. You can place pressure on their liver. You can also do a supraclavicular tamponade to help stem the jugular vein, or turn the patient's head to the side, which can also help to stem their jugular vein. And so you also want to be able to feel it as well as see the jugular vein to avoid any further complications, like getting any plastic in there. So I can see that and I can feel the external jugular vein. So I'm going to go ahead and make sure that I've got my equipment as well. I have my sharps container to place my sharps into for sharp etiquette. I have an alcohol wipe to sterilize the site I'm going to IV cannulate. I have a 20 gauge IV cannulation, but I probably use a 14 gauge in real life, but this is just what was available, and it's attached to a 5 ml syringe with 3 ml of sodium chloride in it that I've already drug checked with my offsider. I also have a ball square in case of any bleeding, a lower plug to prevent backflow of blood, and I also have a 10 ml sodium chloride posi flush that's already been drug checked with my offsider, and that is to make sure that our line is patent and also clear the lower port, and I have a tegaderm to secure the line. So I'm going to go ahead and get my alcohol wipe and ensure that the patient's not allergic to anything. So I'm just going to clean the area aseptically in circular motions, working my way outwards, never cleaning the same area twice. I'm going to place some alcohol on my glove and wait for that to dry. And when holding my IV cannulation, I'm going to hold it with the pinky at the back so that I can aspirate and get check for flashback. So the alcohol on my glove is now dry, maintaining sharps etiquette. I'm going to say, so we're just going to get the sharps out. So sharps out. And I'm going to get do a supraclavicular tamponade as well as get traction and just warn the patient. Give it a sharp scratch, going in at a 15-degree angle. Once I think I'm in, I'm going to pull back and check flashback. And yep, I've got flashback, so I'm just going to advance the catheter 2 millimeters and then just slowly push the catheter in. And removing needle sharps out, extruding the sharps container, and I'm continuing to glue the vein, and I don't need the gauze square. I'm just going to attach that lower plug. Yep, and that is attached. Okay, I'm now going to check if my line is patent and clear the lower port using my posi flush. So I'm going to take the cap off. Just get rid of any air bubbles. Doesn't appeared to be any. Okay. And one patient might feel cold flush, and it should run through quite easily, which it is. So I know we have patient 9, and I'll recap that to keep the area as sterile as possible. All my equipment would be on a buoy to keep the equipment as sterile as possible in the environment, but there were none available. So I'm now going to secure my line. So I'm just going to take some tape and secure the cannula, and then I'm going to grab my tegaderm. Secure the line. And I would note down the date and time as well. I could write the gauge size, that's just for hospital use but also for our records. I'm just going to secure the lure plug down and attach the date and time that I've noted. And that is my EJV OSCE.